Jenny, thanks again for joining this Healthcare's Data Innovations Q&A. Our listeners won't know this. This is our second time. We had some recording and technology issues last time. But this is our second time, so I appreciate you being patient and coming back on. You are, I would say, a fixture in the healthcare St. Louis space, and we've been to, lots of conferences together, panels, you name it, we run into each other, and I'm so glad we have this opportunity to maybe connect and share a lot of the wisdom and experiences that you've had in this space, really more broadly with our audience. So thank you.
Yeah, well, thanks for having me. It's it's great to catch up and do something a little different from kind of the day-to-day. So yeah, this is great.
We all need a little bit of break, right? You got to spice up the day and the week just a little bit sometimes.
That's right.
Well, I'll let you do your own introduction. I want to make sure that you have the opportunity to do justice for your kind of introduction here in our audience today. So I'll kick it back to you a little bit and let everybody know about yourself and the work that you're doing.
Sure. So, I am here in St. Louis. I've been here for I always say long enough to be a Cardinal fan, but I'm not really sure that you want to admit that this year.
It's a struggle in this couple of years. Yeah, it's a struggle.
It's a bit of a struggle. But I grew up in Milwaukee, Wisconsin. Sorry, Brewers are at the top of the baseball list right now. But I always say, like, I've been here long enough in St. Louis to be a Cardinal fan. What I love about this city is, despite things like, sports team not doing so great, right? The community is just such a tight community, and the people here support so many of the different organizations and institutions that we have. And it's kind of what I really love about being here. I've been in technology here in St. Louis for about 30 years, worked for a number of different local companies like Maryville Technologies, and I spent a lot of time at Savvis, which I guess now isn't local anymore because now it's like Lumen, which is very, very big, and some international companies. So at the time it was Monsanto. Now it's Bayer, so it's like hyper international. And of course now I'm at Microsoft. So I've spent a lot of my my technical career focusing on service management and love process, love that kind of rigid approach to managing technology. That's always been something that's been a passion of mine, because I feel if you do that well, everything else will fall into place. And so, I think with that, I'm just, I love technology. I love being in healthcare. This has been a little bit of a new space for me. When I didn't really do healthcare much before I came to Microsoft. Of course, at, Monsanto, that's definitely life sciences, and you have the biotech and agriculture mix and chem and a whole bunch of other stuff as well. But, just really been loving what I'm doing here at Microsoft in healthcare, and of course, just love the St. Louis space.
I think for those that aren't in St. Louis, they may not know, right, that we have this a very vibrant, I think, technology support system, right? Mm-hmm. Whether it be startup, midsize, or in the enterprise space. And you mentioned Bayer, Monsanto. We've kind of we have these, I think, accelerator channels right around agri-science now for, maybe more than a decade, right? It's been in that space. And it feels like healthcare is now in that space over the last 5 to 6, maybe 7 years. You've kind of got these healthcare accelerator organizations like BioSTL and others. And then, lately now we've got this geospatial, right, intelligence and opportunity for really additional verticals, right, to come into the business and have, or in the region, I should say, and be supported. So we've got a plethora of support, I think, across businesses. And even for those folks at Microsoft, right? Like yourself, it's a meaningful opportunity to do great work within the community.
Yeah. Oh, absolutely. Yeah, it's incredible how much the St. Louis area, especially with where the Microsoft office is, that Cortex area, just what an innovation and startup, vibe and presence that's become in the last, I don't know, what would you say, 10 years? Like, I mean, it's really been incredible. And I think for healthcare in particular, the connection with education, Washington University, SLU, like that's been a big part of it as well. So,
Yeah, certainly lots of drivers, right, in the space from academia to industry. And I think the government sector, as well, particularly in the federal services, right, and trying to think about what does it look like to support a GIS hub here in the region is wonderful. But let's get to your kind of career as well, right? At Microsoft, you're supporting a top 25, right? A Fortune 25 organization within healthcare. And, largely it feels like there's almost countless, system level challenges in healthcare and also sometimes system level challenges in these big behemoth companies. So you're in both, right? Trying to figure out how to make digital transformation happen in a meaningful way. I would love to hear a little bit about that experience. I'm sure our, followers would too.
Yeah, I like the term countless because they are countless challenges. The challenges were, especially, I mentioned I've had a 30-year career, right? So moving from just this whole shift like to cloud in itself over the time that I've been in technology has been, something that's been a challenge for all organizations. What I didn't realize is that coming into the healthcare industry, just what a different set of challenges that presented, and how things in the regulatory space and privacy actually took these healthcare companies and put them even like further behind the curve than the organizations that I came from, right? Like your perspective is just so much different because I think, for me, I was like, oh boy, this organization that I'm at just seems really behind. Then I went into healthcare. And when I was first with Microsoft, I was a technology strategist, and I actually worked about 12 different accounts between St. Louis and Kansas City. And so I got a really good view of different, subsectors of healthcare. So whether it was a provider or a payer, or even some of the specialty or pharma. And in each and every case, like how far behind they were just 6 years ago, like not at all cloud enabled. And you think about that and you're like, okay, well, but I just came from a company that was cloud enabling. And now I'm trying to be a technology strategist for companies that almost don't want to hear you talk about cloud.
Yeah.
So that was like a huge challenge. I would say though that, and even still today, the amount of, I'll call it fortressing of infrastructure and data is still very, very prevalent for healthcare. The move to cloud is still not there. I would say healthcare is still on the low end of the maturity curve compared to financial services and other sectors. So it's been a struggle. And I think you have to look at it in the perspective of, I think healthcare organizations are definitely starting to recognize that they don't want to be left behind. And so they are having to make some very thoughtful, deliberate decisions around what they want to take to cloud, how they want to modernize. But, I would say that it's still very, very slow.
One of the interesting things, right, that I typically think a lot about is there's probably no industry that we want and need to adopt, technology in an agile way, and kind of provide that safe space, right, to test and iterate and develop than healthcare, right? But at the same time, right, there's just this lack of inertia, right, that I feel like has maybe slightly changed, right, in this maybe the last 2 years, right? If you think about kind of the open AI space and what does it look like to be able, this term that I've heard a lot now over the last really maybe 3 to 4 years has been learning health systems. How do I become a learning health system? And when you think about learning from every patient or every interaction and thinking about how do you improve your systems across the board, it becomes really hard when you're on like an on-prem Postgres server or something, right? Or an on-prem SQL server. It's like, well, that VM, in the closet or like in your data center is not going to give you the availability to do the work that you need to do to be a learning health system. So I would be curious, are there use cases in the cloud that you've seen where maybe it's the client that you serve now, again, a kind of a top 25, in healthcare, or another client where maybe they weren't ready, but, you and maybe the Microsoft team were able to say, you have to do this. Look at the outcome. We have to be able to do this. Is there anything that you could talk about in that time?
Oh, I sure can. Well, I mean, I'll just use, my customer as an example. And so I think what you have to really do is you have to start to separate what the organization is doing. And, of course, in the last 12 months, the AI explosion has occurred. And that's caused a lot of controversy. But let's pick it apart, right? Because there's, I talked about the fact that a lot of the healthcare organizations are, they move slow because, again, they've got a lot of regulatory and compliance, kind of mandates that they have to adhere to. And so if you kind of abstract that back, and again, I am dedicated to a health plan. So they don't actually provide medical services. They're providing insurance and helping individuals. And of course, in this case, it's our most vulnerable individuals across the United States. These are people who are on Medicare and Medicaid and have to be in marketplace programs. And so when you think about, if you just abstracted that and you just looked at the people within the organization who have job functions that they have to perform, and you think about the fact that there are still, again, for these vulnerable populations, somebody who's on Medicaid, there is still very, very manual processing that is occurring by a person having to take a fax and potentially take the information off of a fax and type it in a system. When you think about just something as simple as that, if you could just abstract that action and automate that using not even generative AI, I kind of call it like old school classic AI, just cognitive services that are doing like the, character recognition to pull that off of a, picture of a fax and automatically enter that in a system. Just something like as simple as that would be such an immense improvement over the manual processes today, right? And I think one of the areas that I've really seen now starting to embrace the AI technology has been the interactions that people are having. And this is probably across multiple industries, but I'll keep it to the healthcare industry. The interactions that people are having. So when they're having to look at what benefits they have, when they're wanting to schedule an appointment, when they're wanting to do something where a person doesn't actually have to be that interface. It really can be effectively addressed with AI. AI can easily schedule an appointment. It can easily provide a summary of what your benefits are. So I think those are some of the most prevalent use cases that I'm seeing is really in what I would call like the operations of an organization, as well as focusing on how an organization would interface with whomever their customer might be.
I think you hit on this piece, right? It's very, I think, relevant in the work that we do, right? That I see and kind of reinforce, right? This work of certainly we've got, AI in precision medicine, right? And we've got kind of integrated care models and all of that. And I would say that's a higher performing, a model, right? Those are pieces where we're going to adjudicate, right? We're going to make sure I get my words right here. I'm going to struggle on this one apparently, but we want to get the prediction right, but we don't want to go to adjudication, right? We want to give physician and maybe direct caregivers options. Some of the highest ROI opportunities for generative AI or, generally deep learning and machine learning continues to be the lowest hanging fruit of workflows, right? How do you get people to operate at the top of their license and stop doing the things that are so predictable every day, right? Not only can you predict it, but you can safely kind of adjudicate and judge it, right? And fully execute that workflow. And save the time for the really hard top, 8 to 15% of the cases, and not, 100 or 98% of the cases. And so whether that be, again, insurance adjudication or generally a digital front door, right, interaction of a chat bot or others, it's relatively simple, right, to say, well, what workflows do we have that are sapping value out of the organization? It might not be best to start with what's the hardest, highest value thing. It might be best to deliver the most value from a lot of low-hanging fruit, right, that cumulatively brings a ton of value back to the business.
Yeah, because actually in a lot of those complex situations, especially on the, like the biomed front and when, precision medicine, and they've already been using AI. Like that's not anything new to them. Like they've already been utilizing and leveraging various types of AI in their models. It's now, I think, how can we use AI in the lowest hanging fruit? And I say that as somebody who has the very good fortune of, being with Microsoft, I get to use Microsoft's Copilot technology every day. And I have to tell you, the amount of time that as somebody who, has to create a lot of, emails and PowerPoint presentations and stuff that, sure, like I like to write, but, do I really, in my day, do I personally have the time to spend an hour on like a well-crafted email? Not really. So could I throw a question over to Copilot and say, hey, I need to write, an executive thank you note. And, here's like 2 points that I want to make. And within 30 seconds, I have an email. And in about another minute, I can cut and paste it into an email, polish it up and send it off and be done with it. Have that interaction take, I don't know, 5 to 10 minutes versus, struggling over the right words to say. A lot of times when I see what's produced, I'm like, oh, that's fantastic. Great. Boom. Let's get it done. Yeah,
I think we've got an opportunity, right, to be thoughtful, right, about how we leverage those resources. And again, how do you institutionalize the value, right, that a co-pilot brings to the day, I think is still something we're all trying to figure out, right? We know the value inherently from our own work, but how do we institutionalize that value and kind of then recreate value with the time that you get back, right? I think it's just one of those things we haven't worked through yet, but it's certainly on the forefront of everyone's mind.
Yeah.
I might ask you too to just expand a little bit on, you've had a strong career, right? You're at Microsoft, you're at a top account, you're implementing technology, one of the most complex spaces, not only in healthcare, but I think also in the benefit space, right? Of complex, vulnerable population in a highly regulated environment.
Sure.
How do you continue to find your place and I guess maybe even establish what's next, right? How do you continue to say, this is where I want to be, and this is the work that I want to do?
Yeah. Well, for me, first and foremost, when I just think about healthcare in general, and let's just call it the state of healthcare in the U.S., which isn't perfect. I don't know that there's a healthcare system across the world that is perfect, but, we certainly have our challenges here in the U.S., and we certainly see what's happening with all the challenges that, our underserved populations have. For me, the motivation is for those that are less fortunate. How do we just make health equitable, period? I think for everybody should have a very positive healthcare experience and not a fragmented or stressful or complex experience. So I'll kind of break it down that way, right? Like, everybody should have a great, simplistic, easy experience. We're not there yet. A lot of, medical information hasn't been digitized because of the regulations and how we operate differently within every state. Like, that makes it difficult. But at the end of the day, take that and think about, maybe some of us as very fortunate people who have great jobs and good health care, and, we're fortunate. And there are others that are not as fortunate as us. And, how do we even provide those people with basic health care? And then when they don't have some of the means that we have, like smartphones and internet access all the time, 24/7, and computers and all this other technology, how do we try to make it as easy as possible for them to get the care that they need? And also now start to be even in like more of a preventative mode. It's a struggle. So do I ever feel like technology would not be relevant in this space? Oh gosh, no, right? Like, I continue to think, and again, when we talked about the maturity of, these organizations, there is so much that is untapped. I feel like we could keep busy for like the next, decade, just trying to get to where we want to be today. And things just keep evolving,
One of the parts that we talk about, right, from a data side, is being thoughtful about what does responsible artificial intelligence look like, right? What is responsible, I'll say, infusing your data with intelligence, right? Not just AI, but you think about analytics and some of the other, visualizations that, a client may look at that just don't always paint the right picture or the fullest picture possible. And I think about individuals, again, from underrepresented populations. You and I and many of our subscribers have primary care physicians, right? And we have a more holistic medical record, right? That's a part of data that says, how can we help take care of people within our population and the health system? We're a part of that, right? We're kind of privileged to be a part of that because of the access and equity that generally we have, most likely because of our socioeconomic situation in our professional employment. So the folks that don't, they're blank holes, right? They're null values in those models that we're creating that say, here's what best in class patient care may look like, or even what workflows look like, right? At the lowest level for our adjudication or other things. That's we've got to be thoughtful, I think, from a technical perspective, and not for this conversation, but from a data science perspective of how do we handle those null values? And then from a business perspective, how do we use that to create these really foundational understandings of existing bias within our system, right? AI, yes, it can add a more bias. It certainly can exacerbate biases, but I think the scarier part is not addressing existing biases that are in your system or your organization right now.
Right.
And you could actually use AI to help you understand where are those underserved falling through the cracks. So I think you bring up a wonderful point of the most vulnerable. If we're not thoughtful about those null values of the most vulnerable people that aren't contributing to the highest level of the data in which we are, taking out of a health system, we're basically building models that don't work for them, right? We're building business assumptions on analytics and, outputs that they're not a part of. And that can be super challenging. And I think not only challenging today, but perhaps even more challenging right in the future.
Yeah. Well, I mean, think about how an organization, like the one that I work with every day, has to address such a complex and diverse set of that, underserved population. And, so we'll take the example of, somebody that's on Medicaid, right? And you think about how, the application process to go through that application process for Medicaid is very complex, requires a lot of documentation. And then you've got factors if you're dealing with individuals that probably don't speak English, maybe speak a little English, have transportation accessibility issues.
Or even those with disabilities, right, that may not have an individual within their home that can support them in a way that they need.
And if you could even just use AI to do something as simple as, can I take a document that somebody who has a high school education could understand and rewrite that down to a 5th grade level so that somebody who was having to fill out a form or somebody that was having to respond to a question could understand it at that level. Like that in itself, like there's no way you're going to have individuals within an organization rewriting all these documents. Yeah. But if on the fly, you can have an AI do that translation or present that, that's a savings right there. And you're making the person that is on the receiving end more comfortable, helping them understand, not making them feel demeaned in any way, right? So I feel like AI has a lot of capability to help level the playing field without maybe people even knowing that there was a playing field to level.
No, I think you bring up another great point, right? Which is no matter what the use case may be, I think it will be I think not only now, but especially over the coming decade, it will be incumbent upon organizations that have resources to utilize artificial intelligence to level that playing field, because much like you bring up a point of something ubiquitous like smartphones, right? That still we have a population of individuals in this country that need medical care that may not have access, right? And certainly don't have access to a smartphone, right? Let alone sustainable housing or sustainable food supply. That's an easier gap to fill than how do we leverage the resources in a competitive business landscape to use artificial intelligence to make sure that we're not leaving populations of people behind that we serve? And
Yeah.
I hear that from in the research space. I hear that in maybe conferences or panels, right? Or there's panel questions that I might field. But there is a concern, right, that I don't hear that from necessarily the standard. It's not standard acumen, right, or standard kind of question processes at the management level in many companies, right, to say what is our responsibility now to use this technology to make it easier for everyone to be included in the services that we offer.
Yeah, I'm going to go back to something that you mentioned, because it kind of ties into what you just said around that responsibility and kind of this ethical considerations. And then you talked about how do you help an organization, understand broadly about AI, right? And I think it's incumbent upon organizations to get in front of AI before they're using it, to help everyone within the organization understand it, and understand not only what it is, how it could be used, possibly give them a voice as to how they would want to see it used, and do that education before they're rolling something out, right? Because I do think that there's a lot of anxiety around, like, am I going to lose my job? Like, AI is going to take over the world. And I don't think that's anyone's intention. The intention is we want to use AI for good, good purposes. Second is in the healthcare space specifically, and this was announced at HIMSS. I don't know if you, I think you were at HIMSS, and I don't know if you heard the announcement or saw it, but there is a consortium, the Trustworthy and Responsible AI Network, TRAIN, to start to work on operationalizing responsible AI principles, right? So that in health, you've got the quality and safety and trustworthiness of AI in all things health related. And the consortium of organizations that are joining together to share best practices, provide tools that help us measure the outcomes associated with AI, and facilitate kind of this development of a federated national AI outcome registry was announced. And I think the fact that organizations that are competitors are coming together and, kind of taking down all those barriers and for the good of health, working together on this, I think is really incredible.
Yeah, I think what we'll see, right, is the continued value of data is going to push more competitive cooperation, right? As you think
Yes.
about regional health systems and others, right? That value of data has an opportunity, right, to be worth significantly more if you can combine forces and still, remain, competitive, but cooperative to each other.
Yes.
And
Yes.
kind of a rising tide raises all ships moment, right? Jenny, let me ask you as we get to finish up here. Tell me a little bit about the work in the community, right? You're always in the community. You're not just, technology and equity and kind of all things move digital transformation and healthcare forward. You're certainly very visible in all things St. Louis. So tell me a little bit about those things that you're passionate about outside of work.
Yeah. Well, I have a lot of passions outside of work. So, like I said, I love St. Louis. I love the community. It's always really disappointing to maybe hear about the St. Louis community being portrayed in the news as one that's, not as overly positive. And so, for me, I think it's there's a couple of things that are really important. And one is, personally, as a female in technology, and I've been a female in technology for a very long time, and I've been in some of the pretty deep technology areas where I've been the only woman in the room, the only woman in the organization. And quite frankly, there are still times where that doesn't change in certain areas. There's like certain pockets of IT that still hasn't had a huge shift in. I think it's really incredibly important to continue to support our young girls and make sure that they have opportunities to learn how to be leaders and to excel in STEM. So, I'm a huge supporter of Girl Scouts of Eastern Missouri, which not only supports, directly the St. Louis city and county, but it also supports the surrounding, rural areas. And that for me has been just a really, really big passion of mine. I love seeing the opportunity and just how incredible our girls of Eastern Missouri are. I mean, it is amazing. And, through that, I did some work with Girl Scouts to establish their women's leadership organization so that we had some kind of continuity for girls that were exiting the official Girl Scouting process, and that they had a place to land after Girl Scouts, so that they had women who were within our community who were professional and successful, and that they could connect with, and that, quite frankly, these women could connect with one another. And so that also is just a big passion of mine, women supporting other women. And that kind of gets into some of the other organizations that I've been working with, like Rung for Women. Rung is a great organization that helps support women who just really are not in an economic position to support their families, and will help them with skilling and learning so that they can go out and land a job that will effectively allow them to support their family. I mean, there's a lot of, women here in the St. Louis area who are single parents. Are, I think, like 38% of these female, led households are living in poverty. And so Rung's done some really incredible stuff around focusing in the technology area specifically to train women in IT project management, geospatial, and help desk and digital marketing. I mean, those are some great areas. And so we're seeing some really, really great success there to help kind of not only close the wage gap, but, again, allow these women to be a viable part of our community.
Yeah, I think, we lose sight of, how challenging, right, that circumstances, either sometimes then or largely, outside of our control, can change at the community level, right? And you think about, Rung for Women and potentially, right, even your Girl Scout group, right, of the individuals that you support within Girl Scouts of Eastern Missouri.
Sure.
How many of them are going to have a professional network that could help them advance their careers, right? Probably a very small margin. We're naturally just going to kind of have that via, their high school network, or potentially, as they go into college, or their family's network, or an intern network. It doesn't really happen naturally, right? There's got to be some force of people that help and want to bring you forward. So I think at the individual levels where we have to make those differences. And obviously, one life changes, generations changed in many cases, right?
Yeah.
And so, you may not be able to address everything at once, but helping to support one person is likely changing a generation or two of that family. That's meaningful, right? Especially at any scale that you can pull it off in. So wonderful causes. Jenny, I want to thank you again for now the second time. You're our first person to get to come around twice. Unfortunately, only ended in one edition. But we'll give you a trophy or something for coming on twice. Well, I appreciate you today.
The dress rehearsal was good. So I think, the live performance was better. So thanks for allowing me to do this twice. And, I enjoyed taking time out of my day to sit down and talk with you.
Thank you, Jenny. I appreciate you.